Hey guys, today I'm going to be conducting a cardiac assessment. The first thing you want to do on your patient is obviously, if he had his shirt off, look at his chest. You want to look at symmetry. You want to look for pulsations, heaves of the chest, which right now I see none. Um, you want to then look at the JVD, the gestacular vein distension. Can you pick your head up? So normally, basically at 30 to 45 degrees, you might see this vein distended. But Dad, can you raise up? Now come up to a seated position. The vein should go away. If not, that could indicate right-sided heart failure. Obviously, it went away with my dad, so that's a good finding. Next, we're going to move into palpation. Palpation is going to be done mainly around the mitral valve. It's the fifth intercostal space at the left midventricular line. Which is going to be, you want to feel for the intercostal spaces, but it's going to be right about here. And you could feel for the pulse. You want to feel for rate, rhythm, duration. And it seems to be regular for my father. Normal is 60 to 100 beats per minute. You want to, make sure you're feeling that regular rate and rhythm. You don't want it to be bounding, or you don't want it to be very faint. Just looking at the heart as a whole, you have the right ventricle, right atrium, left ventricle. The 5 spots we're going to be oscillating are the aortic, pulmonic, Erb's point, the tricuspid valve, and the mitral valve, which was the point of maximal impulse, which you just actually took the pulse from. So I'm going to do that now. You're going to use the diaphragm for this part. Again, you're listening for normal S1, S2 sounds. Keep in mind, S1 is heard best at the top, or the base, the base of the heart, and S2 is heard best at the apex of the heart, the bottom, down here. And we're going to go in a clockwise, well, not really a clockwise manner. We're going to start on the left side, and then go to, or the right side, and go oscillate down the left side of the heart. So I'm going to start on the right side at the second intercostal space, just to see your aortic. Just listening for normal opening and closing of the valves, S1 and S2. Pulmonic, left side, second intercostal space. Erb's, left side, third intercostal space. Tricuspid, left side, fourth intercostal space. And then your mitral, the apex of your heart, the point of maximal impulse, which is left side, right in line with the, it's at the fifth intercostal space, in line with the left midclavicular line. Again, you're listening for just normal heart sounds, opening, closing of the valves. While we're here, we're actually also at this point, it's good to listen for for blocks. Well, actually, you could listen for murmurs here. For example, we'll listen for an S3, which is best heard here, using the bell at the apex of the heart. What you would hear is a sound before S2. It'd be a low sound, and we don't hear it here. So he's not showing the S3 murmur. The other murmur you could possibly hear is S4, which actually goes after, you would hear after S1. That can be indicative of heart disease, high blood pressure. Well, S3 is actually associated with fluid overload. From there, we're going to just look at the pulse sites of the human anatomy here. Look, starting from the head, going down to the toe, you have the temporal, carotid, your brachial site, which is located right here, radial, femoral, which would be in the groin, popliteal, behind the knee, posterior tibialis, which is right behind the ankle there, and then your pedal pulse, which is right on your foot. For our instance here, I'm just going to palpate his radial pulse. And when you're palpating these pulses, you can grade them 0 to 3. 2 is normal, 3 is bounding. He's got a nice normal pulse. So that basically concludes our cardiac assessment for today. So thank you.